cold sores or herpes. So in this lesson, we're going to talk about what causes cold sores, what are some of the other manifestations, what we can do to make the diagnosis, and what we can do to treat it. So cold sores or herpes are chronic clusters of vesicular erosive lesions. Well, what does that mean? Well, as you can see, they are basically groups of little skin lesions that become little vesicles that can erupt and become erosions. They are due to infection by herpes simplex virus 1 or 2. So we used to learn that maybe one of these viruses causes oral herpes, one of them causes genital herpes, but really they can both cause cold sores or oral herpes. Now, the primary infection involving herpes simplex virus 1 or 2, there is a site of inoculation. So if someone comes into contact with someone else that is shedding the virus and there may be a break in the skin, that is the site of inoculation. There can be a sudden onset of multiple painful vesicles on an erythematous base. So you can get this very sudden, very nasty, painful area on the lip or wherever this site of inoculation is, and it can be very red and very sore. And the primary infection generally lasts for about 10 to 14 days. And it may have systemic symptoms. This can include fever or chills, malaise. You just may feel very under the weather with this. Now, the pathophysiology of cold sores and herpes virus in general is that after the resolution of the primary infection, so after that 10 to 14 day period where your body eventually seems to resolve the infection and you're back to your normal self, unfortunately the virus hangs around and it remains dormant within ganglion cell neurons. So they basically stay there, and what happens is, so the HSV or herpes simplex virus hangs around in ganglion cell neurons, and really your immune system basically keeps them in check and suppresses them and keeps them within the neuron, and you're not going to have any symptoms.